At SAMGI, we're a group of surgeons and healthcare providers who help hospitals close the gaps in their surgical delivery of surgical care. So that might take the form of helping a hospital move toward ACS verification or state trauma verification. Other times they reach out to us simply because they don't have enough surgeons in their local community to build out the service line completely. So maybe they're relying on locums, or maybe they're not offering the service line at all. I'm proud to say we have over 300 surgeons working with us now, and we've been able to recruit to environments that have been challenging even for the hospital to recruit to. I think one of the biggest challenges a hospital CEO faces is ensuring that the local surgeons in the community remain engaged and happy with the work that they're doing. And sometimes the call burden becomes difficult when they have a busy elective practice. And so if the hospital can relieve the surgeons, the local surgeons of their emergency call burden, they can focus more wholly on their elective practice, which of course leads to efficiencies in both. As a trauma surgeon myself, I recognize the challenge that the CEO faces when they are bringing a new surgical group into their community. The local surgeons obviously are going to be anxious about another group of surgeons coming in. And I think one of the things that really sets SAMGI apart is that we're more than happy to include and partner those local surgeons in our practice model. So I think what we do best is we learn from our potential hospital partners what the challenges are that they're facing and trying to solve for, and we build a team that solves exactly for that. So SAMGI does deliver a significant ROI for our hospital partners. As you'll see in our peer-reviewed published paper, our service lines have a reduced length of stay, but that reduced length of stay creates capacity within the hospital and reduces cost for the hospital. And it turns out that our service is also associated with an increased CMI. But for the hospital, it translates into higher revenue for these patients. And in fact, in our paper, we show about a $2 million ROI per year for an average size program. We have a customer retention rate of over 90%. So we're quite pleased with the durability of our programs. And I think the way we achieve those long-term success stories is that we morph with the program. So we may engage with the hospital to solve one problem in the beginning, but we help them as they grow and move through their journey as well. And so we are adaptable with them. We have incredibly stable workforce. We have a over 98% retention rate among our surgeons, and they like doing this kind of work, so they remain engaged in doing it long-term.